Welcome to Shared Decision Making for Aging Veterans. This is Shared Decision Making Team Training, the second component of a three-part orientation and training series for the implementation of shared decision making for aging veterans at a clinic, in a service line, or into a new or existing program. Leadership orientation occurs prior to this training and is a brief session for VA Medical Center or other leadership, such as Medical Center Director, Director of Primary Care, Director of Social Work, or Director of Nursing. This is Shared Decision Making Team Training 1, an introductory training for entire care teams and support staff. It can also be used as an introduction to shared decision making for older adults for any group, VA or external to VA, from geriatric scholars to interested non-VA providers. Facilitating shared decision making, Training 2, follows team training. This practice-based training is for those most involved with the facilitation of shared decision-making discussions for aging veterans. It is a 1.5 to 2 hour training conducted via video teleconferencing. While this online team training is designed for VA staff, if you work in a non-VA setting, you may find this training is also valuable in your organizational setting. This training takes about 35 to 45 minutes to complete. This course covers an overview of shared decision making and why it is especially helpful to aging veterans, using shared decision making for long-term services and supports choices, a tour of www.va.gov/geriatrics and an introduction to shared decision making resources and tools, the team approach used in shared decision-making and roles of care team members. Talking with older veterans, including information about communication challenges and effective strategies for addressing them. Next steps to implement shared decision-making for your aging veterans. There are a few videos embedded in the training. Note that you will need to watch the complete video in order to go to the next session. At the end of the training, there will be a quality improvement assessment with questions and an opportunity to provide feedback. Please note there is an extensive notes and citations document with references for much of the information provided in this training. It can be accessed by clicking on the magnifying glass icon in the lower right corner of many of the slides. Shared decision-making is a collaborative, patient-directed decision-making process for preference-sensitive choices. Shared decision-making works best for preference-sensitive choices, decisions for which the patient's goals and priorities play a considerable part in choices that are made. For aging veterans, choices among long-term services and supports and advanced care planning are common topics that need to be addressed, and the choices made are very preference-sensitive. This is quite different from a situation where someone has acute appendicitis and there is not much need for a shared decision-making process because the choice about what to do is not preference-sensitive. Shared decision-making is collaborative in that it involves the veteran, the family caregiver, and the whole patient care team, including the physician, the nurse, and social worker. And shared decision-making is patient-directed in that it not only involves the veteran, the final decisions are up to the veteran. We will discuss this more later in the training. The focus of shared decision-making choices is on what matters most to the veteran. Shared decision-making is an evidence-based approach. There is a large and growing evidence base for shared decision-making as illustrated by this table. Overall, shared decision-making, including the use of decision aids, is linked with better outcomes for patients and families, including improved knowledge, feeling better informed, and more involvement in decisions and care. Click on the icon at the bottom right of this slide to see the notes and citations related to research on shared decision-making. Shared decision-making has become a popular term, so it is frequently used without reference to anything specific beyond the intention to provide patient-centered care. As we have discussed, our use of shared decision-making is a process which is collaborative, patient-directed, and ideal for preference-sensitive choices, such as choices of specific long-term services and supports that foster aging in place. The shared decision-making process includes 6 key components. Encourage the veteran or any older person to identify what is most important to them, their goals and priorities. Clear goals make it possible for the veteran to make choices that lead toward those goals. So if remaining independent is an important goal, both the care team and the veteran know that home and community-based services are probably a better choice than institutional care. Provide comprehensive information and tools. Provide access to them. Comprehensive information about the range of long-term services and supports allows the veteran and their family to make informed choices. The Geriatrics and Extended Care website is an excellent source of this comprehensive information for aging veterans, as you will learn. Depending on where the veteran is located, it is possible that not all the services and supports described on the website are available, but it is still very important for the veteran to be aware of the full range of services, as you never know what choices the veteran may make. Knowing the range of possible services, a veteran may consider moving to another location, perhaps closer to a family caregiver or to where they can obtain the service that best meets their needs and supports their goals and priorities. Use decision aids in conversations to help elicit values and preferences about choices. These are discussions among the veteran, family, social worker, and medical care team. Remember that the decision aid worksheets are self-assessment tools that prepare the veteran and family for discussions with the care team. There are often multiple discussions with different members of the care team at different points in time. The decision aids can help get a conversation started and assure that many aspects that affect a decision are considered. And the worksheets may raise topics that would not have been addressed otherwise. A family caregiver's responses to the caregiver self-assessment may raise caregiver concerns that the veteran then has to consider when making choices about their living situation. Support veteran understanding of medical conditions. In addition to treatment options, the patient needs to understand the likely effects of their health conditions on their ability to perform daily tasks at the present time and as their illness progresses. An understanding of the likely course of their conditions may also affect the choices they may make about long-term services and supports or their preferences in their advanced care plan. Another component of shared decision-making for aging veterans is to support veteran independence. In addition to being aware of the full range of services, this may well require use of services in the community as well as those provided by VA, and it often requires revisiting the mix of services and supports chosen on a regular basis. As time passes, the veteran's needs and preferences may well change. And the last component, respect veterans' choices, is essential. The veteran is the decision maker. It is possible that the veteran will make choices that do not align with your best professional judgment. Be sure to provide the veteran and their family with the best available information and with your professional expertise. But in the end, a key component of shared decision-making is that the process is veteran-directed and that their choices are respected. We have focused this shared decision-making program on older veterans, as almost half of the veterans served by the Veterans Health Administration are over 65, and those over 80 are the fastest growing cohort, and older veterans are most likely to have multiple chronic conditions and to need long-term services and supports. The development of shared decision-making for aging veterans is based on research with older people, some conducted at VA. In general, research has found that older people want to be asked about what is important to them, as do most people. Having the veteran clarify their goals is very important. Making assumptions about what the veteran or their family wants is not good practice. People may resist participating in shared decision-making discussions, but involvement is usually appreciated in the end. Research shows that older people want information about home and community-based services. In the past, people's awareness was often limited to nursing homes, and nursing homes were often seen as a place for old people to go to die. Home and community-based services support people in remaining independent in their own homes. Older people need to learn about these services as they support them in meeting their health and life goals and priorities. Older people have preferences that may change over time due to changes in their health status, the status of family caregivers, stress, and other factors. The goals, needs, preferences, and choices of the veteran and their family need to be revisited frequently. Older people, and especially veterans, are often accustomed to following their provider's orders and not voicing their thoughts or opinions. This is one reason it may be difficult to get older veterans and their families to voice their choices. Providers can help by encouraging the participation of veterans and their families and respecting their choices. And last, research has shown that older people have lacked tools such as decision aids and a process like shared decision-making discussions to facilitate veteran-directed decisions. This situation has made it particularly challenging for older people and their families to make patient-directed choices. One goal of the shared decision-making process is to shift the veteran's role and the interactions with care team members from a medical model focusing on provider expertise toward a process of patient-directed decisions. As we move across the spectrum from the more traditional medical model toward patient-directed care, we move through a place of patient-centered care. This is care that focuses on the needs of the patient, such as a Saturday clinic for those who work 8 to 5 on weekdays. Patient-centered care is important, but it does not address how decisions are made. Patient engagement begins to address involving patients in the decision-making process. We engage them in discussions. However, this may still fall short of having them be the central decision maker. When we implement patient-directed care, we go further by saying that not only is the patient involved, but the patient is in charge, and that ultimately the decisions are theirs. For example, in the case of long-term services and supports, the veteran, after discussion with care team members and the social worker, may decide to stay at home with the support of adult day health care and homemaker home health aid services. The provider and social worker may think that an adult family home would best meet the patient's needs, but the patient may make a different choice, and the care team needs to honor that choice. In a moment, you'll take a tour of the VA Office of Geriatrics and Extended Care's website, and in particular, Your Guide. Your Guide contains information and tools designed specifically for our veterans and their families that supports veteran-directed decisions about topics commonly faced as we age. Note that Your Guide supports independence as we age by providing comprehensive information that supports the use of home and community-based services to age in place. The website tour covers a lot, but the only way to really become familiar with the website is to use it. The tour takes about 6.5 minutes. As you saw from the website tour, shared decision-making for aging veterans has a strong focus on long-term services and supports, which are often needed by our veterans as they age. Here again is the page showing all of the home and community-based services and a sample page on one of those services, palliative care. Advanced care planning is another topic for which shared decision-making is well suited. Leadership and staff at a number of medical centers have told us that they like to use the shared decision-making process for advanced care planning discussions, as those discussions are appropriate for all older people and something that staff is required to do. The website tour introduced you to the broad array of advanced care planning information on the Geriatrics and Extended Care website. Here you see the advanced care planning handout with information on one side and a values worksheet on page 2. And just like the shared decision-making decision aids, this worksheet is for the veteran to use and then to serve as a guide in advanced care planning discussions with providers and social workers. There are also printed materials available for veterans and caregivers who are not computer users or who prefer materials in a hard copy format. The folder contains an overview of long-term services and supports, abbreviated from the website, the Veteran Shared Decision-Making Worksheet, and a Caregiver Self-Assessment Worksheet. There are also handouts on advanced care planning and well-being, as well as a wallet card, and a place for providers and social workers to jot down their contact information on the reverse side. The folders can be given or mailed to all older veterans and to any veteran and/or family caregivers who are or will soon be engaging in discussions about choices related to long-term services and supports or advanced care planning. This is particularly important for veterans who do not use computers. In addition, there are bookmark-style brochures available for placement in racks, exam rooms, or waiting rooms. The decision aids are an important part of the shared decision-making process. You may already be familiar with conventional decision aids used to make choices among screening or treatment options. These decision aids are different in that they are not oriented toward a specific illness, test, or treatment, but rather designed to assist consideration of the range of services that can be used to support independence as we age. These decision aids start with an exploration of what matters most to the person in terms of their goals, their needs, and their preferences, and then moves to an examination of resources and services to meet those preferences. The shared decision-making worksheets are self-assessment tools, not professional assessment tools. Providers and social workers already have a number of patient assessment tools. These decision aids are designed to assist veterans in evaluating their needs and resources, and in choosing the services and supports that will best help them meet their goals. The Veteran Decision Aid Worksheet can help guide a veteran through the shared decision-making process, along with discussions with their family caregiver and their care team members, such as their physician and social worker. It can be filled out by a veteran, or the topics can be used in a collaborative discussion with the care team or social worker. The caregiver self-assessment helps a family caregiver assess his or her roles and responsibilities and can prompt readiness for participation in shared decisions. These tools can be downloaded from the GEC website, mailed to the veteran, or handed to them at a clinic visit. Implementing shared decision-making requires collaborative team involvement, resulting in veteran-directed decisions. All staff has a role in encouraging veterans and caregivers to engage in the shared decision-making process, communicating with each other and making referrals to social workers, providers, mental health staff, and chaplains as appropriate. Remember, it is important to encourage involvement in the shared decision-making process for all veterans and their family caregivers. Not everyone says they want to be involved in these decisions. However, research shows most people want to be involved in decisions, even when they say they don't. So support veterans in clarifying their personal goals and priorities, obtaining the available information, and using the decision-making tools to make choices. Let's review the roles that each of us can play in this process. Nurses often introduce shared decision-making to veterans and their family caregivers by providing them with a shared decision-making brochure or folder. They may also screen patients for participation in the shared decision-making for aging process. Some service lines or programs choose to target veterans by age, such as 65 or older, or the number of chronic conditions they have, or the severity of the conditions they face as measured by their care assessment need, known as a CAN score. Other sites have a shared decision-making clinic time set aside for veterans who are targeted through screening. Nurses may also encourage veterans and family to review the Geriatrics and Extended Care website. They can give the veteran a brochure with a website address and suggest that the veteran and/or their family review it. They may give the veteran the shared decision-making folder and review its contents, as well as encourage veterans and family caregivers to complete the decision aid worksheets, or at least to review them. It is valuable for them to convey the value of these worksheets to the veteran and their family, to explain that completing and discussing these worksheets among themselves will lead to more beneficial discussions with their care team and better choices for them. Nurses may also note whether or not the veteran and their family seem to understand the veteran's health conditions. If there appears to be any lack of understanding, the nurse may provide more information or encourage the veteran to talk with their provider so that they thoroughly understand their health conditions and how those may affect their functional status. And very importantly, the nurse can arrange for an appointment with the social worker. As social workers are usually the key facilitators in the shared decision-making process, this visit can be very beneficial for the veteran and their family. Providers, particularly physicians, influence their patients' decisions. For this reason, providers can have considerable impact by encouraging their patients to participate in shared decision-making. By recommending veterans and family explore the Geriatrics and Extended Care website, making sure they get the shared decision-making folder and know what it contains, and very importantly, encouraging them to review and, if possible, complete the decision aid worksheets. Providers also provide key components of shared decision-making when they ensure the veteran understands their medical conditions and how those affect their functional abilities, facilitate a discussion of the veteran's goals and do their best to ensure they are realistic given their health status, and then suggest the veteran use specific long-term services and supports that are likely to meet the veteran's preferences and help them achieve their goals. Providers have limited time, and social workers are often even more skilled in facilitating conversations with patients about their goals and preferences and suggesting choices that meet those goals and preferences. So providers can facilitate veteran appointments with social workers and other care team members, coordinate with other medical care team members prior to making recommendations to the veteran, make referrals to long-term services and supports that the veteran has chosen, and accept the veteran's choices even when they do not reflect the provider's judgment. Social workers are often the team member with the most skills for facilitating shared decision-making discussions and the most time allocated for having those discussions. If some of the tasks mentioned previously, such as screening the veteran for shared decision-making discussions, recommending use of the Geriatrics and Extended Care website, ensuring the veteran has the shared decision-making folder, have not been handled by the nurse or provider, then the social worker should do them. Additional shared decision-making tasks that are usually addressed by social workers include ensuring that discussions with the veteran start with identifying what is most important to the veteran, working with the veteran to involve family or a family caregiver as appropriate, using the decision aid worksheets to facilitate conversations about the veteran's needs and priorities and resources, and given these topics how best to achieve their goals, and ensuring veterans are aware of the full range of long-term services and supports, particularly home and community-based services. Home and community-based services can support veteran independence, aging in place, which is what most older people want. Encouraging veterans to talk with their provider if they have questions related to their health or the likely course of their illness. Supporting the veteran in making choices, veteran-directed choices. And as with physicians and all others on the team, respecting the veteran's choices even if they are not in agreement with your professional judgment. Finally, ensuring referrals are completed. As we all know, simply making a referral is often not enough. Social workers may need to follow up with those referrals and make sure they become operational and that the veteran knows how to use them. Because social workers are the key facilitators of shared decision-making discussions, we have another training that is specifically for them and others who view themselves as key facilitators of these discussions. This is a case scenario-based training and provides skills and practices for carrying out this challenging work. If you are part of a VA shared decision-making implementation site, this training will be provided. If you are at another facility and are interested in this training, please contact us using the information at the end of this training. The family caregiver or caregivers may or may not live with the veteran. Nonetheless, if there is a family caregiver, their involvement in the shared decision-making process should be encouraged. Input from the caregiver may affect the veteran's choices about topics such as long-term services and supports and advanced care planning, or even moving. The caregiver's roles include supporting the veteran as the key decision maker, engaging in the shared decision-making process by listening to the veteran and asking questions to clarify preferences, needs, and goals, and also by assessing their own roles and responsibilities. This can be done using the caregiver self-assessment worksheet. Then the caregiver needs to talk with the veteran they care for to communicate their capacity for providing support, including limits related to caregiving. It's possible that caregiver input may affect the veteran's choices about long-term services and supports or advanced care planning. The veteran's role is to be the key decision maker. The first step in this process is for the veteran to identify their goals, needs, and priorities. In order to clearly understand their needs, they often need additional information about their health conditions from their provider. For example, they may need to know more about the likely course of their health condition and its effects on their functional status, now and in the future, in order to make choices about the long-term services and supports that may best support their goals and priorities. The veteran also needs to have comprehensive information about long-term services and supports and complete the veteran shared decision-making worksheet so they can discuss their goals, needs, and preferences with their care team, family caregiver, and social worker. Only at this point is the veteran Only at this point will the veteran be ready to make choices, veteran-directed choices. Communication barriers may be caused by normal aging, an aging-related health problem, the environment, or even our tendencies to stereotype older adults. Older veterans may be dealing with health concerns such as hearing or vision deficits, difficulty with speaking or recalling words, dementia, or they may be affected by medication side effects such as fatigue. It is also important to remember that over 60% of people over 65 in our country are at a basic or below basic level of health literacy and health numeracy. And sometimes the environment can pose communication barriers, things like background noise or lack of a private space for a conversation. There are also many challenges associated with talking about topics related to aging. They are difficult topics. As a result, people often do not want to talk about the aging process because they are uncertain or afraid, or they are in denial about declines in functional abilities. Some people have a serious dislike for discussing getting worse or dying, or for that matter, changes they may have to make related to requiring assistance for activities of daily living or to accommodate declines in function. Some veterans and family caregivers think that long-term services and supports only means a nursing home and that a nursing home is where one goes to die. And sometimes the challenge will be to engage in shared decision-making with an aging veteran who sees the healthcare team members as their commanding officers and prefer that you just tell them what to do. It can be hard to strike a balance between respecting autonomy and stimulating involvement in shared decision-making. Shared decision-making discussions can be sensitive, so they rely on trust among the participants. It takes practice to become skilled in having conversations about goals and preferences. In addition to good communication skills, such as active listening and starting where the veteran is at, prepare yourself by making sure the environment is set up well, quiet, and free of distractions. Allow enough time to accommodate various aspects of aging that may impact optimal communication, as well as to elicit veterans' values, goals, and preferences. And be mindful of factors such as readiness to talk and hear information, related cultural, religious, and social issues, and family dynamics. When talking with veterans and family caregivers, ask them if they are ready to talk about sensitive topics such as long-term services and supports or advanced care planning. When doing assessments and finding out what matters most to the veteran, use open-ended questions or statements like, "Tell me how you spend your days." Use active listening skills, focusing on what the veteran says or asks and not on your reply or a fix or a solution. Be sure to give the veteran enough detail so they understand their illness or conditions, including the likely course and how their life and what matters to them may be affected. Always talk in a straightforward way, avoiding jargon, and then check to be sure the veteran and family understood what you said. For example, use the teach-back method. You might say, "Help me know if I've done a good job of explaining this. What is your understanding based on what I said?" And of course, be sure to clarify if needed to ensure you have understood a veteran or a family caregiver's questions and concerns. Goals are rooted in values. Goals are detailed descriptions of activities or states and describe living according to what matters most to veterans. Neither patients nor most healthcare team members are skilled at discussing goals, but by focusing on two main questions, you will be able to gather information that will help with collaborative shared decision-making discussions. What's working well in your current healthcare and the way you manage your conditions? And what bothers you or is burdensome about your health care? Whether it's the veteran, family caregiver, physician, nurse, social worker, or other healthcare team member engaging in the collaborative discussions, meaningful goals will be based on values, which are linked to what matters most to the veteran. They'll be specific by deciding exactly what to do or not do. They'll be realistic, meaning that what the veteran desires is doable. They'll be measurable, meaning they have deadlines or ways to check on progress. And they'll be included in a plan where time has been spent thinking through barriers and how to get around them. And last, meaningful goals are flexible, meaning they can be revised as needed. To focus strategies on maintaining independence, try openers like, "Let's talk about living with Parkinson's," or whatever the veteran's conditions are. It is critical to ensure that the plans made and the selection of long-term services and supports, sometimes within VA and outside of VA, are directed at achieving the veteran's stated goals and preferences. When possible, integrate the agendas of veterans and their family caregivers. Ideally, the veteran's choices are supported and respected by all care team members, even when the veteran's choices may not be the ones you would want the veteran to make. And you'll want to encourage ongoing discussions because both health status and goals change over time. The Training 2 session, Facilitating Shared Decision Making, provides more evidence-based strategies for effective communication with older adults, with case-based scenarios to practice facilitating shared decision-making discussions. In sum, shared decision-making for aging veterans can be used for making decisions about long-term services and supports, as well as advanced care planning. To review, when putting it all together and applying the shared decision-making process to decisions about long-term services and supports, be sure to ensure veteran access to information about the full range of long-term services and supports using the website or printed materials. Use decision aid worksheets to facilitate discussions about what matters to the veteran and how to meet those goals and needs. Ensure the veteran and family understand the veteran's health conditions and how they may affect function. Encourage use of home and community-based services to support independence and aging in place, and support and respect the veteran's choice of setting and services. For VA shared decision-making implementation sites, confirm which programs or service lines will implement shared decision-making for aging veterans, perhaps in your PACT clinic, Geri PACs, home-based primary care, or other programs. Determine your clinic service line screening criteria. Examples of screening criteria include all veterans over age 65, or those who appear to have need for services, all veterans who have not completed an advance directive, veterans with multiple chronic conditions, those with extended care needs, or veterans who have a high care assessment need or CAN score or other type of screening score. Staff who most often discuss long-term services and supports with veterans complete the next training, Facilitating Shared Decision-Making Training 2. This 1.5 to 2 hour training is offered via video teleconferencing and can be scheduled at your convenience. The Training 2 session, Facilitating Shared Decision-Making, provides more evidence-based strategies for effective communication with older adults with case-based scenarios to practice facilitating shared decision-making discussions. Wait for notification from your leadership to begin implementation of shared decision-making for aging veterans. And know that selected staff will be asked to participate in quality improvement interviews or to provide names of veterans and caregivers willing to participate in a brief telephone interview. For non-VA sites, if you are from a community-based non-VA site and are interested in further training and implementation in your setting, please see the contact information at the end of this presentation. We are excited you have decided to implement or are considering implementation of shared decision-making for aging veterans or other older people. Now, please complete the quality improvement assessment questions to ensure we know that you have completed this course and to help us improve it for future participants. Thank you. We appreciate your feedback about what you liked about this training and what we can do to improve it. Be sure to visit www.va.gov/geriatrics soon and explore the information, resources, tools, and links about all aspects of shared decision-making for aging veterans, from long-term services and supports, including home and community-based services, to well-being, paying for long-term care, and advanced care planning. If you are familiar with the website content, you'll be in a great position to recommend that the veterans and family caregivers you work with take time for a visit. And you can stay current by reading the geriatrics and extended care news features or checking out the other staff resources. Thank you for completing the Shared Decision Making for Aging Veterans Online Team Training 1. If you are in a staff role where you may be facilitating shared decision-making discussions with veterans and caregivers, please attend a Shared Decision-Making Facilitation Training 2 session, which is conducted via video teleconferencing and provides practice with case-based scenarios. If you have questions about or interest in shared decision-making implementation, please email us at sdmagingveterans@va.gov. We look forward to hearing from you.
So let's see here. I don't get enough sleep left.